Good evening to everyone and welcome to today's presentation. Is it audible? Harendra Pratap Singh, White Coat Princess, Alek Seth, Sudha Shukla, Saumi Mandal, Ravi Kumar and many more across the country. Next week you will all be beaming with enthusiasm to face Dharma Kshetre, Kurukshetre, NEET PG 2019. So, is the voice clear or is it low? Can you please punch whether the voice is loud and clear to everybody or is it low? Can you please punch? It is low. Put it in full. Okay. Thank you. I think now it will be clear. Yeah. Endemic cardiomyopathy in children. Selenium deficiency is associated with the Keshan's cardiomyopathy is what you should remember. Fine. Beta blocker therapy. What are the contraindications is the favorite question of the examiner. Any heart failure which is grade 3 or grade 4 under the NEHA classification, or orthostatic hypotension, bronchial asthma. The list of contraindications for the beta blocker therapy you have to be very sure about. What are cyanotic congenital heart disorders? Shoot your answer, doctor. Parallelly keep shooting your answers. Last 30-40 questions we will go like a quiz. Initially we will try to go a little more faster. So can you please keep punching your answers? Give me the board. Yeah. Now you are given the board? Yeah. So you should remember 4 T's in relation to cyanotic heart disease. T for tetralogy of Fallot, T for transposition of the great arteries, T for truncus and T for tricuspid atresia. All these 4 T's lead to the development of cyanotic heart disease, where the bad blood of the right side mixes with the good blood of the left side. When right mixes with left, you get the cyanosis, whereas left shunts to right, it is still acyanotic is what you have to remember. So all these conditions which have been shown to you, they lead to the Sudha is saying that it is not clear. It is clear? Absolutely. Sudha, can you check? I'm worried whether they are able to hear it clearly or not. So, all of you unanimously tell that the sound is fine and you are able to go ahead, then no problem. Are you getting any disturbance? No, right? Okay. Very clear, loud and clear. Thank you. So, hypoplastic left heart, complete transposition of the great arteries, and a single ventricle with or without pulmonary stenosis. They are all the examples of cyanosis is what you have to remember. 34-year-old non-diabetic, normotensive, ST elevation, but trop T is normal and a repeat ECG after 24 hours is normal. Question number 9 is for a bet by all of you. Please punch your answer, doctor. Shoot your answer. Sudha, Vipul, Monica, Abhishek, Sareem Hussain, Saumi Mandal. Please punch your answers for this question. That's good. I can see B versus D. Ravi thinks it is acute MI in spite of a normal trough T. Ravi, the fundamental definition of the MI is the presence of the elevated cardiac enzymes makes it an MI. Otherwise, it is either a unstable angina or a fringe metal angina are the possibilities. So, this is the classical case of fringe metal angina. You can see the ST segment elevation, the QRS, T wave, and this the ST segment elevation is what you are able to clearly see. Now my question to all of you, looking at this ECG, what is your diagnosis is my question to all of you. Give me which territorial diagnosis you need to punch your answer. In this given ECG, what is very good? Alex said can identify lead 2, lead 3 and the AVF where the ST segment elevation can be seen, which is a classical case. Tomorrow examiner is going to give you the ECG. Priyanka, Gulam Bhatt, everyone, you are right. Inferior wall above. Now, opening snap. First of all, where do you listen opening snap? Mitral stenosis, you listen opening snap. Opening snap is what kind of sound? Is it diastolic or systolic? A high-pitched low amplitude or a low-pitched high amplitude is a very, very important question. Should your answer, doctor? Question number 10. Let me check how good you are. If you answered this question wrong, just jump in to the U-Medico video library where you can be able to review heart sounds in general medicine, cardiology. Lecture number 3 or lecture number 4, there is a 30 to 45 minutes ka charcha on the heart sounds, dynamic auscultation of the sounds, which you have to review going back to the video library if you answered this wrong. Alex Seth is betting on A, but most of you are thinking, Dr. Ashwini also thinking B. Absolutely. High pitched low amplitude. Such things can be heard by the diaphragm. It is a early diastolic because mitral stenosis itself is a early diastolic event is what you should remember. So, aortic stenosis, what is the type of murmur, doctor? Systolic crescendo, decrescendo murmur. Like an aeroplane, zoom, it will go up and then zoom, it will go down. All that happens during the systole. Crescendo, decrescendo murmur is what you need to remember. And aortic regurgitation is like, you hear lub, dub, lub, dub. Lub is S1, dub is S2. S2 is the closure of aortic valve and lub is the closure of mitral valve. After the closure of the mitral valve, what will ventricle do? The ventricle will classically contract. So between S1 and S2 you have the systole. Between S2 and S1 you have diastole. So aortic regurgitation is a diastolic phenomena or a systolic phenomena, doctor? Give me the board please. What is aortic regurgitation? Is it a systolic phenomena or a diastolic phenomena? Is an important question. So you have S1 and then S2, then comes S1. S1 pe mitral valve closes and S2 pe AV aortic valve closes and once more S1 per mitral valve closes. After mitral valve closes, ventricle contracts and pumps the blood. So this is all systole. Between S2 and S1, what you have is called diastole. So, aortic regurgitation, if you take, how do you listen the sound? Typically, why do you listen the sound? When is the regurgitation happening? After the left ventricle completed its systole and pushed the blood into the aorta, after the aortic valve closes, when the ventricle is starting its diastole, that is the time the blood in the aorta is gushing back into the ventricle. So that is the reason it is a diastolic sound is what you need to basically remember. Which part of the diastole do you listen aortic regurgitation, murmur? Early part of the diastole you listen this aortic regurgitation murmur. इसलिए आपको लब सुनाई देगा, दब सुनाई देगा, उसके बाद सुनाई देगा like you exhale the air. That kind of sound is early diastolic sound of the aortic regurgitation. That is the reason what will you do to the patient? You will ask the patient to sit in the bed, incline forward, hold the breath, and then you put the step, lab, dub, lab, dub. That is called as aortic regurgitation, like a postcoital sound. You listen like a breath sound. You listen the aortic regurgitations. Early diastolic sound is what you have to basically remember. So always cardiology is like पूरा दिन दिए तो भी हम cardiology चर्चा करते हुए आगे बढ़ सकते. So that is the reason, but we need to move forward. So doctor, S1, then you have S2. Then when left ventricle fails, you get S3. Left ventricle hypertrophies, you get S4. And S3 and S4, both of them are during the diastole that you listen is what you need to remember. Saumi, Mandal, you need to, we have a lot, tons of cardiology discussed in the U-Medico app video library. General medicine mein jao, DNB question bank jao, AIMS question bank jao, or PGI, everywhere cardiology, what are all the 14 topics that you should get perfect. They have been discussed in the context of the various MCQs like this. So, what I like to tell you is, last 1 week, this is the time to consolidate what you are not yet confident, but what is compulsorily going to come in the exam. Can I do something? Already patient is on ventilator. Can I do something else? Can I do a bit of dialysis to bring his creatinine down? His renal shutdown done? Can I do that? Is the last 1 week. And pray God to give you strength and courage. Always remember, winning the battle has nothing to do as to how many soldiers you have. Winning the battle of the NEET PG has nothing to do as to how many days you read, how many books you read, how many hours you read. It has no relation. Be bold, be courageous, use your common sense, and have at least the working knowledge on some of the common topics that the examiner is going to ask. You will do the miracle, let me tell you. So, if you look at opening snap of the mitral valve, opening snap of the mitral valve is typically a diastolic phenomenon. Obviously, ventricle filling is called diastole. From where will it fill? From the atrium, it should fill. For the atrium to fill into the ventricle, it has to open the mitral valve. That's the reason mitral valve is a ventricular filling event. At that time, that during the diastole you listen the opening snap is what you should basically remember. So, S2 OS, ये दोनों के बीच में कितना टाइम डिफरेंस है is very important to talk about the severity of mitral stenosis. अगर mitral stenosis बहुत severe है तो लेफ्ट एट्रियम के अंदर बहुत प्रेशर बिल्ड हो जाता. जब बहुत प्रेशर बिल्ड हो जाता लेफ्ट एट्रियम के अंदर because of the stenotic mitral valve, when the mitral valve opens, it opens with tuk like a champagne cork. It will be opening and you listen a loud opening snap is what you need to remember. So the opening snap jitna jaldi aayega S2 ke baad is dependent upon how severe. If the S2OS gap is very narrow, if the opening snap is happening very early part of the diastole, then you should consider it as a more severe mitral stenosis is what you have to basically remember. So I leave the literature for you since we don't have time now. Opening snap versus S2 and S3. Opening snap, S2, S3. ये तीनों बहुत नजदीक रहते हैं एक के साथ एक in the diastole. You need to differentiate between the two. I leave the literature for you. Now, doctor, sudden onset of the cough followed by dyspnea. Classically, you will see it whenever there is a pneumothorax. One patient, if you see, especially the smokers with an emphysematous bullae, when they are going home, sometimes a bulla ruptures and suddenly you are thinking that I am discharging a stable patient, but that patient can end up in a severe hypoxia, become completely unstable, and you need to parade him back to the acute medical care. So, lot of times such things happen. Multi-drug resistance means at least isoniazid, rifampicin ke upar resistance hai to you call it as multi-drug resistant. A patient has pulmonary TB, he develops drug-induced hepatitis. Ethambutol doesn't cause any hepatitis. Rifampicin, pyrazinamide, isoniazid, they all have got a hepatic effect is what you need to remember. This is a beautiful question. इसका सही उत्तर दे दो आपको नीट पीजी में मैं सीट पक्का करके चेयर क्लीन करके आइए आइए आपका सीट रेडी है बोल दूंगा. Let me check how many will answer this correctly. I am going to America to meet my girl Monica. Absolutely right, Monica. Jindabad. So arterial PCO2, not the PO2. Ritudas thinks minute ventilation, clean bowls. No problem. The point is, थोड़ा tease करे तो हमको we will get that what is that called as high esteem to go back and read. So that's the only idea. So a lot of times people think PO2. No, it is PCO2. Why PCO2? Because if you look at carbon dioxide, there is no way that carbon dioxide can get rid of the body except by exhalation. इसलिए carbon dioxide, partial pressures are an important indicator that how good is your ventilation is what you need to remember. Which is a DNA virus? Easy question. Hepatitis B, as all of you know. Tinea solium, tinea saginata infestation. इसका सही आंसर दे दो. I am very sure you are going to crack 10 out of 10 in microbiology. Question number 21. Let me see how good you are. Ravi thinks it is nicosamide. Rituraj, Vipul are thinking B, Abhishek, Vyas also, Roshan, Yadav also. But Upen, Ravi, super dupero. It is nicosamide, doctor, nicosamide. Once more I will tell you. Drug of choice for the various parasitic infections for every NEET PG student, it is a big quagmire. You should immediately, after this session is over, should immediately jump to the U-Medico app, go to the pharmacology and then review anti-parasitic drugs is the topic which is waiting for you to review and bookmark in the notes some of the important tables. So that is how you should prepare. So those who are using the U-Medico app, can you please punch whether your reminder notifications every 15 minutes are they coming back to you or not? Or anybody is not getting the notifications in the reminder notifications, are you getting or not? Can you please punch on the U-Medico app? Those who are all using, please punch. Yes. So Very happy to see 84 online students. Sorry, we got little late today to start the session. So I hope the notifications are all working well. If not, please let us know. Yes. Very high serum transaminases. Except where is an important question. So you should remember, alcoholic liver disease you don't get a very high means 1500, 1000, utna bade values nahi aayega. So you should remember that if you look at the alcoholic liver disease, AST is 6 to 7 times upper limit of normal. AST-ALT ratio is around 2:1 is what you need to remember. Now, necrotizing papillitis. Where do you see necrotizing papillitis? Yes. So, typically sickle cell, diabetes, analgesic nephropathy, they're all the classical underlying causes. Perinatal का मतलब क्या होता है? Perinatal होता है 28 weeks of gestation to 1 week after the birth is what you should remember. Alport syndrome का mode of transmission क्या होता है? Let me check how good you are. Question number 25. This is another rate limiting question. How good you are will be known by correct answer for this question. Question number 25. Soumya Mandal, Vanilla, Alexei, Abhishek Vyas, they're all thinking autosomal recessive. Right? Autosomal recessive. Upain, Monica, Dasari. Dasari is thinking variable. So, why you are not thinking X-linked? Correct. It is X-linked is what you have to remember. Ralyani Yatin, absolutely right. Okay. So, broadcasts are classically seen in which situation? They are seen in chronic renal failure when the tubular dilatation occurs. That leads to the development of the broadcasts is what you should remember. Now, doc. Amaurosis fugax typically occur in which situation? When the retinal artery gets occluded with a thrombus, sudden falling of curtains leading to blindness is the typical presentation. No, you are all mistaken. It is not brainstem. Sarim Hussain is presenting, he is saying correctly, retina. Vitamin B12, subacute combined degeneration of the spinal cord, as all of you know very well. So, Raju Mallela is saying not getting the reminder. If you are not getting reminders, please check whether your Medico notifications in general in your settings, if you have put it off. Otherwise, you please call our helpline. We will be more than happy to check your particular mobile app, why the notifications are not coming. Okay. Now, doc. Polyneuropathy kaha hota hai? Uremia, hyperthyroidism, diabetes mellitus. All these are the classical examples of polyneuropathy. A young boy with a history of left ear discharge develops a right upper limb focal seizure. So what do you want to do? It is a classical case of brain abscess. Common underlying cause is the ear infection. So urgent CT head and the antibiotics is considered to be the management. All of you know very well, sickle cell anemia lead to splenectomy, autosplenectomy. So you don't see the large spleen. Megaloblastic anemia, which is the drug not implicated. Obviously, clavum, the amoxicillin clavulanate lene se megaloblastic नहीं होता, phenytoin, methotrexate, pyrimethamine, there is a list of drugs. Cyclophosphamide, zidovudine, please don't forget, can lead to development of megaloblastic anemia. And oral contraceptives, nitrous oxide, many times asked, don't forget, and arsenic are responsible for the megaloblastic anemia. Disseminated intravascular coagulation में क्या होता है? There will be multiple coagulation cascade which is stimulated that lead to development of the clot formation in which the platelets are all sequestered, and that lead to development of the thrombocytopenia is what you need to remember. Now, with regard to the HASEC group of organisms, how do you like to describe them? Let me check who will answer this correctly. Question number 39 for your testing. Shoot your answer. Question number 39 for betting. Yeah. Ravi thinks it is D. Sudha also. Yeah. HASEC group of organisms which lead to culture negative endocarditis. Solomon, Akshay Chugh also clean bowl. Sean Chaco also. Monica Sharma also. Right? So this is how Sindhu Lakshmi also is clean bowl. Right? The cure rates are less with HASEC group of organisms. So some questions में पूरा दुनिया उल्टा पलटा हो जाता. So if somebody answered such questions right, it doesn't matter. You should answer 70 to 80% of जनरल आम आदमी आंसर करने वाला करेक्ट क्वेश्चंस को आप भी करेक्ट करें तो then only you will get a good score. So all of you have gone wrong. I don't know why. They are fastidious, fast growing, gram positive, whose growth requires atmosphere of L16 is what you need to remember. Only Kulkarni Sai Charan lastly delivers his opinion when everyone gone wrong. Good. So not correct, not Miss Nayona, except Miss Nayona. So not is not the description of the HASEC. Otherwise B, C, D, everything is correct. Okay. Yes, not is there. The cure rates of the HASEC group, if you happen to discover that the culture negativity, why it is there, is it fungus or HASEC, and then treat them, they are not very virulent organisms, and you can be able to get the recovery. Yes, not is given. That's the reason A is the answer. Yeah. So HASEC is Haemophilus aggregatibacter and Cardiobacterium hominis, Echinella corrodens, and Kingella kingae is what you need to remember. So a last moment में मुझे accept नहीं दिखाया, not नहीं दिखाया. So all these are visual aberrations which you have to not complain that they are the reasons that made you to fail. Honestly, such things even if they happen also, one or two questions में ऐसा आप triple हो सकते, but they won't be the reason for losing the seat. 80% questions examiner purposefully gives such that a well-prepared student will be able to answer 80% question paper. So that 80% of the well-prepared student का अगर आप answer नहीं कर पाए तो then the chances become bleak, right? So there's a reason these 80% questions come from at most 2 to 300 of the 650 topics. So last moment may take a quick chance. The top 20-25% of the high yield topic list I gave to you, keep revising them in the last moment, right? Now, a 50-year-old male, progressive dyspnea, quarry worker. So you should remember it is silicosis classically. Splenectomized patients में क्या होता है? capsulated organism infection होता है. So it is the Streptococcus pneumoniae which is typically the one whose infection you will see overwhelming infection in splenectomized patients. Vitamin D resistant rickets. Give me your confident answer, doctor, about it. Question number 42. Let me check who will answer this correctly. Vitamin D resistant rickets. 42. Should you answer? Yes. So Ravi thinks renal stones nahi hota hai. At least not go up, they clear. Soumi Mandal thinks, oh no, Soumi. Classical example of X-linked dominant condition, very few. That is the vitamin D resistant rickets. You cannot do this wrong. Right? How come Solomon, Krishna Soumya are also clean bowl? So doctor, C. Dr. Ashwini is 100% right. Congratulations, Ashwini. So, reduced renal stones, then you have the renal stones, hypophosphatemia, X-linked inheritance pattern. You should not forget. So, the most common genetic disorder causing rickets, because of the hypophosphatemia is the hypophosphatemic rickets. Female carriers are affected. It is X-linked dominant and the problem is on XP22. So, a X-linked dominant ka, another common question asked is, tomorrow examiner is going to give you a pedigree. Let us say father is affected. Father mein ek X-ray tha, mother is not affected. So, what happens when a son is born? For the son's birth, father contributes only Y chromosome, not his abnormal X chromosome. So, none of the sons are affected. For the daughters, father give the X chromosome. So, any daughter is because of the father's X chromosome and that X has got a X-linked dominant. That's the reason all daughters are affected. None of the sons are affected if the father is the one who is affected along with the unaffected mother. Whereas, father is not affected. Father is normal X hai unka. Mother is affected because one of her chromosomes is abnormal. A combination agar ho gaya to, how will be the children? So obviously, whenever the son is being born, son is born because of the Y chromosome by the father, but an X chromosome of the mother. So that is the reason, if that X chromosome is a dominant abnormal X chromosome, that son is affected, whereas the daughter, the other son who received a normal X from the mother and obviously normal X of the father, he is the one who is unaffected. So, agar mother is affected, father is unaffected, 50% of sons are affected, 50% of the daughters are also affected. Whereas, if the father is affected, mother is unaffected, then all the sons are affected, but all the daughters are all the daughters are affected and all the sons are free from the disease. This is the important tricky question tomorrow on the X-linked dominant inheritance with the affected father, unaffected mother combination में क्या होता है और unaffected father, affected mother के combination में क्या होता है. That is what the question is, the examiner is going to ask. So, where is the defective gene in vitamin D resistant rickets? It is the FEX gene. FEX का full form क्या होता है? phosphate regulating with homology to endopeptidases on the X chromosome को PEX बोलते हैं. And it is very important, it has a very important role in inactivating the phosphatonin called FGF23. So whenever there is a mutation of the PEX, there is increased level of the FGF23. And increased FGF23 क्या करेगा? It inhibits the 1-alpha hydroxylase in the kidney and decreases the production of 125 vitamin D. And it will also lead to decreased phosphate reabsorption and increased phosphaturia. So that is what the PEX gene mutations will have, is what you need to remember. So because of the 1-alpha hydroxylase deficiency, they will have rickets and poor growth, delayed dentition, tooth abscess, hypophosphatemia, short stature, etc. So how do you treat them? It is a receptor level resistance to the action of vitamin D. So इसलिए vitamin D देने से कुछ भी फर्क नहीं पड़ता. So you can treat it by giving phosphorus, which is they are losing in the urine, along with calcitriol is what you should be able to give. And to treat the short stature, growth hormone is going to help them. So that is the whole story, doctor. Now shoot your answer. 8-year-old child, itching in the scalp, black dot appearance. What is your diagnosis? फटाफट बोलो. आप लोगों में कितने लोग को चमड़े की डॉक्टर बनने का ख्वाहिश है? बोलो. How many of you want to be dermatologist? Wonderful profession, cool life, lot of money, lot of opportunity to treat. Skin is the largest organ system in the body, right? Right now you should have dreams. Next 1 week पूरा ख्वाब में जी के एग्जाम को जाओ. डिप्रेशन मत बोलो मेरे सामने, ठीक है? So कुछ भी नहीं रहता डिप्रेशन. Very good, Ashwini, congratulations, right? So next time if I find a psoriatic lesion, I will refer the case to you, Ashwini. Very good, very good. Abhishek Vyas, dermatology is also like a general medicine only. There are so much of general medicine actually you should know, being a dermatologist. So, tinea capitis is what you need to remember. Now, doctor, leprosy में lepra reaction. What is your answer? Lepra reactions are a feature of lepromatous leprosy, right? More often than type 2 lepra reaction actually. लूसियो फेनोमेना कहाँ दिखता है? लेप्रोमैटस लेप्रेसी में दिखता है. लेप्रोमैटस लेप्रेसी में, not in tuberculoid leprosy. Lucio phenomena is such a severe reaction, and it is seen typically Caribbean, Mexico, etc. Diffuse lepromatous form of leprosy and recurrent crops of sharply demarcated ulcerative lesions in the lower extremities with subsequent septicemic bacteremia is what you should remember. Now, with regard to the schizophrenia, इसका आंसर दे दो डॉक्टर. आप साइकियाट्री पढ़ने की जरूरत नहीं है. करेक्ट आंसर मारो, गेस मारो. Without a question on schizophrenia, NEET PG नहीं रहेगा, right? So at least you don't get time to revise psychiatry. 5 टॉपिक मेरे लिए रिविजन करो. What are they? Schizophrenia, right? Compulsory question आता है. Then what are the indications, contraindications of the electroconvulsive therapy? Very frequently asked question. Then antipsychotics, antidepressants का Side effects वो सब. Personality disorders is another very common topic. So doctor, like that what you should do, no? मेरा वाला 10 टॉपिक मैं पढ़ के नेक्स्ट 2-3 घंटे में खत्म करूंगा ये सब्जेक्ट, वो एटीट्यूड रहना लास्ट 1 वीक में, पूरा सब्जेक्ट नहीं. लेट मी क्लोज आईज, बी वेरी श्योर व्हाट आई एम गुड एंड बैड विथ. These 10 topics I am going to read next 2 to 3 hours. फटाफट जाना. यू मेडिको में आपको वीडियो लाइब्रेरी, you pick up any question bank, either JIPMER or PGI or AIMS or DNB or the All India. You have all the question banks and their video discussions topic wise are available. वो 10 topics खत्म करो and say, play quiz on the YouMedico app and say goodbye. Antim darshan you should tell to these 10 topics. Okay. So question number 45, I see a lot of people saying C. Excellent. If one parent is psychotic, the chance of the child getting psychosis is only 10%. But if both the parents are schizophrenic, it is at most 40 to 50% of risk only is there. When both the parents are schizophrenic is what you have to basically remember. Similarly, brothers, sisters hai to kitna, uncles and aunties hai to kitna, etc. etc. First cousins schizophrenic hai to hum kitna chance hai schizophrenic hone ka, etc. etc. Okay? Right. But one thing is there, doctor, always remember, if your roommate is schizophrenic, there is a great chance that you will not be schizophrenic, because 2 schizophrenics can never be the roommates. So, in the medical college. Similarly, PG entrance preparation also. What happens is, it's very rare to see 2 roommates or 2 closemates, both of them getting the top 100 ranks. थोड़ा मुश्किल हो जाता. But there will be a situation that one guy gets in top 100, second guy at least reasonably gets 600 or 700 rank. वो तो होता है. That positive effect always is there when people study together for the NEET PG exam. Okay, so don't worry. I'm always your classmate, and you all know better subject than me. And because you study more number of hours the subject, so that is the reason. Anyway, I am not going for NEET PG. You will only have chance to top the NEET PG. Okay. So, organophosphor poisoning may, how is the intermediate syndrome is a very important question. In intermediate syndrome, motor functions are only affected. Sensory nahi affect hota. So what is meant by intermediate syndrome in organophosphor poisoning? Usually it presents 12 to 96 hours after the exposure. There will be action tremors, pharyngeal weakness, difficulty to swallow. One case of OP poisoning with intermediate syndrome, अगर आप acute medical care में देखें तो आप भूलेगा नहीं. So after you have resuscitated a patient of OP poisoning, they can develop intermediate syndrome. Later they cannot flex the neck, the DTRs are lost, cranial neuropathies, proximal muscle weakness, respiratory muscle paralysis. Some of them may require a reintubation, and totally it is symptomatic, but good thing is they will get a recovery, but you need to be ready to give a ventilatory support to the patients is important. Now doc, opiate poisoning के लिए what is the important specific antidote? Naloxone, as all of you know very well. Catheter associated UTI, what is the correct statement? All of you know very well what is the definition of microscopic bacteria, bacteria. 10 to the power of 5 पर ml से बढ़कर अगर कॉलोनी काउंट है तो सिम्टोमेटिक केस है तो That is called as a microscopic bacteriuria is what you need to remember. अभी आ गया गर्मा गर्म क्वेश्चन. Type 1 renal tubular acidosis. अगर इसका wrong answer बोले तो it is high time that you go back to the Medico's video library and review renal tubular acidosis. Dr. Murali Bharadwaj is expert in renal tubular acidosis. Then Liddle syndrome, Diddleman syndrome, Bartter syndrome. When you are students of Dr. Murali, you should not do this wrong. Excellent. I am proud of all of you. It is a normal anion gap metabolic acidosis because of the hyperchloremia is what you should remember. Give me the board, doctor. Normal anion gap metabolic acidosis is what you need to remember. So a quick review for you. What is anion gap? Anion gap क्या होता है? Sodium plus potassium minus bicarb plus chloride. So suppose if bicarbonate decreases, only bicarbonate decreases, then the anion gap will be increased, like in diabetic ketoacidosis. Along with fall of bicarb, if the chloride increases, also chloride increase along with the fall of bicarb, then the anion gap will not be affected. Anion gap will be normal, is what you should remember, which happens in renal tubular acidosis. So, if you take, this is the glomerulus, this is the Bowman's capsule, then we have the proximal tubule, ascending and descending loop of Henle. So, proximal tubule के level पे क्या क्या होता है? Bicarbonate is reabsorbed, amino acids are reabsorbed. So all this reabsorption basically happen at the level of the proximal tubules. Now, if you look at the calcium, the calcium is prevented to form the stones because of the presence of oxalic, because of the presence of citrate. The citrate in the tubular fluid prevents the formation of calcium stones by binding with the calcium. Anything that makes the citrate levels to come down will precipitate the formation of the calcium stones is what you have to basically remember. So what is meant by type 1 renal tubular acidosis is very important question. Renal tubular acidosis. There is a problem in the distal part of the renal tubule, but still who is intact? Proximal part of the renal tubule is still intact. So, when there is an acidosis continuously, there is a increased absorption of the bicarbonate into from the tubular lumen into the tubular cell, and from there it gets absorbed into the serum. So, acidosis will promote excessive citrate reabsorption in the proximal tubule, and because of that the citrate levels in the tubular fluid kya ho gaya usko? Typically the decreased citrate levels in the tubular fluid will decrease. That is the reason calcium, there is nobody to sequester it, and that lead to the calcium stone formation. Once more summarize, when the distal renal tubule is not functioning and there is an acidosis, still the proximal tubule is functioning. So when the proximal tubule is functioning, Proximal tubule is capable of reabsorbing the citrate, and the citrate reabsorption increases, and that leads to development of decreased citrate level in the tubular fluid, and that precipitates the calcium stones, because calcium is no more captured by the citrate, because citrate already moved into the tubular cell and it is no more there in the tubular lumen in the case of the distal renal tubular acidosis. Now you will ask a question, sir, एसिडोसिस है तो सिट्रेट का रीअब्जॉर्प्शन क्यों बढ़ रहा है, सिट्रेट क्यों रीअब्जॉर्ब ज्यादा क्यों हो रहा है? ऑब्वियसली इज देयर अ क्वेश्चन इन योर माइंड, राइट? नाउ सिट्रेट अंदर गए तो सिट्रिक एसिड साइकिल में पार्टिसिपेट करेगा. सिट्रिक एसिड साइकिल में क्या रिलीज होगा? कार्बन डाइऑक्साइड रिलीज होगा. कार्बन डाइऑक्साइड क्या हो जाएगा? कार्बोनिक एसिड H2CO3 बनेगा. H2CO3 से क्या पैदा होगा? HCO3 minus get generated. So, when there is a significant acidosis, the tubular cell in the proximal tubule is hungry. मुझे बाइकार्बोनेट चाहिए, कहीं भी देखो मुझे बाइकार्बोनेट चाहिए बोल के एक राक्षस बैठ जाता है. कहां बैठ जाता है? प्रॉक्सिमल ट्यूबुलर सेल के अंदर बैठ के ये राक्षस बोलता है कि मुझे बाइकार्ब चाहिए बोलेगा. इतने में हुजूर आपको बाइकार्ब मिल जाएगा, हम अभी बाइकार्ब का छोटा भाई को लाया है. बाइकार्ब का छोटा भाई कौन होता है? सिट्रेट होता है. Citrate just got filtered into the glomerular, into the tubular fluid, and the citrate is thinking that, oh, my job is to capture the calcium inside the tubular fluid, but इतने में राक्षस का लोग आके उसको पकड़ के tubular cell के अंदर लेके जाएगा, और citrate converts into through the citric acid cycle into carbon dioxide, into carbonic acid, into bicarbonate, and राक्षस खुश हो गया. इसके वजह से सिट्रेट का लेवल्स क्या हो गया? ट्यूबुलर फ्लूइड के अंदर कम हो गया. एंड बिकॉज द सिट्रेट इज लो, द कैल्शियम स्टोन्स गेट precipitated is what you have to ultimately remember. So that is the reason. Where do you find calcium stone formation? You see it in type 1 renal tubular acidosis, because in type 1 renal tubular acidosis, distal renal tubule is not functional, and to compensate that, the proximal tubule will consume the citrate in the tubular fluid, and the low citrate in the tubular fluid leads to the precipitation of the calcium stones. But you don't find calcium stones in type 2. Type 2 में calcium stones are not found, is what you should remember, right? Because type 2 में क्या होता है? Proximal tubule itself is damaged. So that is the reason you don't find renal stones in type 2, but you will find it in type 1. यही बात याद रखो. You will remember Dr. Murali Bharadwaj in the tomorrow's exam, and Dr. Murali Bharadwaj in the tomorrow's exam, and once more post lunch एक मर्तबे यूमेडिको ऐप के अंदर जाके वीडियो लाइब्रेरी में लिटिल सिंड्रोम, बार्टर सिंड्रोम, डिडलमैन सिंड्रोम, रीनल ट्यूबुलर एसिडोसिस, ये 4 टॉपिक्स आपको मेडिसिन के अंदर फोल्डर के अंदर मिल जाता. रिवीजन करो. Tomorrow's exam में one of this will come. Crack it. One of the differences between type 1, type 2 RTA you should be sure. So doctor, impaired distal ammonia production in the distal tubule is the problem in type 1 RTA. So type 1 RTA is distal. So agar ammonia is not secreted into the urine anion gap become positive, and urine pH will be more than 5.5, and plasma bicarbonate is low, even potassium levels are low, urinary calcium levels are high, there is a stone formation, urine citrate levels are low in case of the type 1 renal tubular acidosis is what you need to remember. So, this is a classical distal collecting duct का cell distal tubule में ऐसा दिखता. So, normally its function is capture H plus ion combine with ammonia to form NH4 plus to enter into the urine. That is affected, that is decreased in case of the distal renal tubular acidosis. But at the same time, you should remember that bicarbonate and chloride have got a competition. So, when the bicarbonate in urea increases, commensurately, the chloride absorption back into the cell, into the plasma increases. Isliye, this is a hyperchloremic type of metabolic acidosis. That's the reason it's a normal anion gap metabolic acidosis. That is what you should remember. So, I leave the literature for you, doctor. Any amount of time is not sufficient. हम शाम तक जनरल मेडिसिन डिस्कशन तो मजा आता है, right? So, thank you very much, Ashwini, Alexei, Saumi Mandal. I am addicted to your compliments. Honestly, let me tell you, without this is my lunch, this is my dinner, this is my breakfast. Your compliments make me stomach full, right? So, thanks for giving your time. And next week, I will be waiting for all of you. Next 1 week, full high spirit mein raho. And every day evening 6 to 8, we will play Tambola like review, so that 20 topics in as many subjects as possible. I'll try to check your last moment flight check, it is called as, right? I'll do. And while you are all writing the NEET PG exam, like a father waiting when his child first day goes to the school, वो क्या करते रहेगा, nursery जा रहे, huh? So I'll be waiting for you when you come back, how you wrote the exam, how you enjoyed writing the exam. That's very important, right? Now, it is the hypertension, intermittent renal coli, macroscopic hematuria, ये सब आपको adult polycystic kidney disease में दिखाई देगा, not massive proteinuria. Pinpoint pupils, what are the P's that you will basically remember? Pontine hemorrhage, morphine poisoning, OP poisoning. Pinpoint pupils is what you should remember. Rheumatoid arthritis में, what are all the complications that you see? We find pleural effusion, fibrosing alveolitis, pulmonary nodules, etc., etc. Everything in the rheumatoid arthritis. Keep punching the answers. Right middle cerebral artery. Right क्या होता है? Non-dominant hemisphere होता है. So जब non-dominant hemisphere is affected, aphasia is not a problem. Aphasia typically occur when person is having right hemiplegia with the left hemisphere, which is the dominant hemisphere. So always when right hemiplegia is there, you should always worry, because they will also have aphasic problems, is what you need to understand. How does metoclopramide act as an antiemetic? It basically suppresses the dopamine levels. It is anti-dopaminergic, is what you need to understand. Primary systemic amyloidosis में what type of amyloid आपको दिखाई देगा? If you answer this correctly, this question is for bet. You are ready for amyloidosis topic. Amyloidosis is another slightly painful topic. Yes. Vishal thinks it is AA. Everyone thinks AL. Very good. So, AA versus AL. That is the same confusion for all the students. It is a AL, doctor, primary systemic amyloidosis. A wrong agar kare to, you need to just please take a chance. Amyloidosis Sure short topic for the NEET PG exam. Cystic fibrosis में azoospermia रहेगा, pancreatic insufficiency, GI obstruction, but not polyneuropathy is what you should remember. 60-year-old, auditory hallucinations. He filed a police complaint against them, but the allegations were proven to be wrong. He feels that everyone is conspiring against him. Sometimes when we walk into reading room, we think everybody is thinking about us only. Honestly, everyone have their own hemorrhoidal pain. So no one gets time to think about you. You are the best person to think about yourself. Maybe your girlfriend or boyfriend will think about you. Right? So question number 63. Excellent. Most of you are thinking delusion. Come on, doctor. Auditory hallucinations. Say people are talking about you. Jaswinder Kaur, Sean Chaco. Oh, how come you're all attracted to delusional disorder? Right? Yes. Alek said, Balakrishna, everyone is saying schizophrenia. Absolutely right. Idiopathic primary pulmonary hypertension. So where do you see this? It is more commonly seen, young female. I can never forget. Lakshmi was my first primary pulmonary hypertension case that I have ever seen when I joined MD General Medicine. So she is a farmer's wife and a wonderful mother of 2 children, and she was otherwise fine till recently when she started developing shortness of breath while walking, and then on evaluation found to have 60 millimeters mercury of the right-sided pressure, pulmonary pressure. So typically 20 to 40 is considered to be mild, 40 to 60 is moderate, 60 to 80 is severe pulmonary hypertension. So that is pulmonary arterial pressures which you need to remember, right? So it is usually asymptomatic to begin with, and there is some role of the autosomal dominant inheritance. Wilson's disease may confuse hona mat. Ceruloplasmin levels are low, urinary copper levels are high, plasma copper levels are low. That's what you need to basically remember. So there is a hepatolenticular degeneration, serum ceruloplasmin low, it is autosomal recessive. ये सब चीजें ट्रांसुडेटिव प्लूरल एफ्यूजन दिखता है आपको, but what is not transudative? Question number 72. Should you answer, doctor? Yeah. 72. Ravi is strongly proposing mesothelioma. Absolutely. Absolutely good. So you should be ready now with high SOG, low SOG, ascites. Similarly, what are the Light's criteria of the pleural effusion? How to discover transudate versus exudate? There should not be any confusions. Now, doctor, let's take up the next question. Yeah. Secondary tumors of the lung. What is a wrong statement? Question number 73. I like to give you some time for you to start answering. I'll wait for your answers. Ravi is proposing there will be respiratory symptoms. Rocket Trader also. Right. So you should remember, quite often there will be no respiratory symptoms when secondary tumors come to the lung. Then they are usually multiple and bilateral, and the diagnosis is made from the radiological examination is what you need to remember. Now, PAS positive foamy macrophages. You should be very sure to answer this question. Question number 74. Come on, फटाफट answer करो. Time for you to react more and for me to remain a bystander to watch. Even one of you answer correctly, I'll move on. Excellent. Whipple's disease, Rituraj and Monica. Excellent. What are the various modalities for the management of achalasia cardia? Achalasia cardia. 75. So, we do the dilatation of the lower part of the esophagus. Balloon dilatation, Heller operation, excellent. Botulinum toxin, Monica, Prahlad, Vishalakshi, everyone is right. Now, absolute contraindications and relative contraindications. This is one area, always it is a confusing quagmire. Some method you should develop to remember that in sequence and not confuse an exam. Absolute बोले तो examiner means to say only absolute, उसके absolute के सिवाय कुछ भी नहीं चाहिए उसको. Kabir Nanda, Sindhu Lakshmi, they are all proposing option C. Rocket Trader also, excellent doctor. So you should remember, less than 6 weeks postpartum, smoker, hypertension, past history of venous thromboembolism, current or past history, it is considered to be a absolute contraindication. Similarly, ischemic heart disease, history of cerebrovascular accident, and diabetes with retinopathy and severe cirrhosis, liver tumors, they are all considered to be absolute contraindications. इस स्लाइड को आप बुकमार्क करना यूमेडिको ऐप में. आर यू अपलोडिंग दिस स्लाइड्स इमीडिएटली? या दैट्स गुड. सो यूमेडिको में आपको कल तक के पूरा स्लाइड्स पावर पॉइंट स्लाइड शोज आएगा. टेस्ट बोल के एक फोल्डर है, मॉक टेस्ट बोल के, उसके अंदर आप बुकमार्क करके रखना. देन इन ऑब्स्ट्रक्टिव लंग डिजीज versus restrictive lung disease, what are the differences? Examiner's favorite question. Very happy to see 117 online. Yeah. So Ravi thinks it is D. Okay. Monica thinks decreased vital capacity. Most of you are thinking, because I'm telling you, आप नीट पीजी स्क्रीन के सामने बैठते ही आपको आएगा एक रेस्ट्रिक्टिव वर्सेस ऑब्स्ट्रक्टिव लंग डिजीज के बीच का डिफरेंस वाला एमसीक्यू. देयर इज नो वे नीट पीजी विल बी डिफरेंट फ्रॉम दिस. इट विल बी मोर और लेस सिमिलर टू दिस. सो दैट इज द रीजन. ओनली थिंग इज, having attended so many chai pe charcha sessions with Dr. Murali, every day attending quiz, so many question papers, guessing your answers, आपको इवेंट एंग्जाइटी नहीं रहेगा एग्जाम हॉल में. आराम से ठंडी दिमाग लगा के यू हैव टू विन द एग्जाम. ओके. सो आई एम सीइंग ए वर्सेस डी वर्सेस सी. इट इज डिक्रीज्ड एफआरसी by TLC is wrong. Remaining are all true. Increased residual capacity, FEV1 by FVC less than 70%, right? So except is there. Okay. Rasmussen's aneurysm. If you answer the earlier question ना, आप please review यूमेडिको ऐप में वीडियो लाइब्रेरी फटाफट रिवीजन करो. COPD टॉपिक के बारे में, वेरी इंपॉर्टेंट टॉपिक, बहुत बार हम चाय पे चर्चा किया इसके बारे में, राइट. नाउ it is a dilated vessel in the tubercular lung cavity is a true statement. Acute rheumatic fever में what do you see? What you don't see. So all the acute rheumatic fever का major, minor, modified criteria you should be very sure about. Question number 79. Please punch your answers, doctor. Dr. Anuj Nigam. Anuj, you are from which part of the country? Is it Maharashtra, UP? From where are you, Dr. Anuj Nigam? So, and what is the branch Dr. Anuj Nigam is aspiring to become? So, you should always keep an aspirational branch, always, right? एक target रखना पड़ता. Very good. I can see most of you saying B, that is only subcutaneous nodules and erythema marginatum, because butterfly rash is a feature of SLE, Osler's notes are the feature of infective endocarditis. Excellent. Anuj from Indore, MS Orthopedics. I am just waiting for you to win. Excellent. Next time when I come to Indore, I love to meet you and all your classmates, right? So, from next week onwards, every week I will be there in one or the other capital cities of the country to promote the YouTube participation by more and more number of students every week. So, please help us to organize in your respective cities a show to promote this evening program, everyday program across the year, right? So, aortic regurgitation may, question number 80, very good. I can see wide pulse pressure and early diastolic murmur and angina, any of these can very much come, right? So, next question. Regarding antibiotics, which is not given orally, is a very important question. Should your answer, doctor? 81? Except. Very good. Ravi proposes linezolid. Excellent. But amikacin, is there any oral amikacin, Ravi? आजकल गांधी मेडिकल कॉलेज में मिल रहा है क्या? Right? So, the hormone relaxin in pregnancy, is secreted by what? From where is this hormone relaxin is produced in pregnancy? Ritu Raj is proposing ovary, absolutely right. Now, heparin therapy in pregnancy, अगर prolonged heparin therapy दिए तो, there are certain complications of heparin. Especially pregnancy itself is a thromboembolic state. On the top of it, those women who have antiphospholipid antibody syndrome or SLE, who became pregnant, you have to manage the pregnancy with a high thrombotic risk. So, I can see most of you saying D. I am very proud of you all. Excellent. It is not teratogenic unlike warfarin, which is a great advantage. Misoprostol pregnancy में अगर दिए तो, the next question, which is not the route of administration. One of these is not a route of administration. Right. Right. Anuj is right. Warfarin is teratogenic, but low molecular weight heparin is not so. So, I can see most of you saying intravenous misoprostol nahi hoga, right? That's good. Oral hoga, vaginal, sublingual, all these routes you find. Laparoscopic female sterilization के बारे में आपका विचार क्या है? फटाफट बोलो. What are the contraindications for the laparoscopic female sterilization? Question number 85. Yes. Should your answer? Yes. Yes. I can see A, B, C, very wide opinions. Gunashekar is thinking C. Monica also. So, it is the obesity. Obesity is not a contraindication. But heart disease, respiratory dysfunction, hiatus hernia, they are all considered to be contraindications. Mifepristone, we use it for the induction of the labor. How does mifepristone lead to the development of labor? What is its mechanism of action? Yeah. 92. Ravi, Kabir are thinking on C. Rocket Trader, Shilpi are betting on D. Right? In fact, all of them. So, if you look at the action of mifepristone, it is a partial agonist, progesterone receptor modulator, and during luteal phase, it blocks the progesterone levels, increase prostaglandin, and it increases the uterine contraction, and it sensitizes the myocardium to the action of the prostaglandin, which lead to development of the contractions leading to abortion to happen, which is considered to be the mechanism of the mifepristone, is what you should remember. A man underwent vasectomy. Very common thing that the surgeons forget to tell their patients. Proper counseling miss ho jata, and one more pregnancy comes, and the man will put his wife in Agni Pariksha and put the doctor also in Agni Pariksha sometimes. So, tell me, doctor, what is your answer? Excellent. So, for how long abstinence or a alternative type of contraception need to be practiced after the vasectomy, doctor? What is your advice to the patient? Kitne number of ejaculations stuck? Patient need to be careful and practice alternative contraception. Excellent. For at least 2 months, 8 weeks or 20 ejaculations, the patient need to follow the alternative form of contraception. Now, with regard to the vasectomy, iska garma garam answer de do, doctor. Highest failure rate. Which type of vasectomy may highest failure rate is a very important question. Yes. Ravi is proposing C. Okay. 94. Sindhu also. Rocket Trader Jindabad. Badhiya, badhiya. Excellent. Even Gunashekar also is right. Srilata also is right. Very good. Srilata, you are from which part of the country? From Hyderabad or from Bangalore? And what is your favorite branch? Let us all know. Srilata want to see MD Gynops or MD General Medicine? Yes. So you should remember open-ended vasectomy with the granulation. Very good to see Srilata from Hyderabad. Open-ended vasectomy with granulation formation. Now, what are the eligibility criteria for the female sterilization except, right? What are the eligibility criteria? Question number 95. Give me your answer, doctor. Good to see 126 online watching. Until 6th January, we will keep the videos without being removed. And I am very happy by the time it is midnight, almost 1000 plus students are viewing it even though they could not attend the live session. So please tell your classmates, your friends that the revolution of free YouTube every day across the year with Sunday full scale grand test plus discussion to inspire you across the year without you wasting a lot of money on the live face-to-face classes, etc., etc. Right? So you have got this opportunity. So face-to-face classes anytime are great because you have a chance to directly perspire and transpire along with the teacher. But they are often crowded, and if you are not a person of crowd, you are gone. And if you can't match up that day, you are gone. Same time, only video library is very boring because you need inspiration to master the video. So, a fine balance between these two, a live plus the video, is a YouTube session every day conducted by us, and that gives you a chance to know what topic shall I focus in the Medico video library. Okay, doctor? Yes, that's right. Online live, along with all your other classmates, you get that inspiration. That's good. So at least 2 living children का जरूरत नहीं है, 1 है तो काफी है, right? That's right. That's right. Thank you, Abhishek, for saying that. Soumi Mandal saying a good adrenaline rush. Absolutely. And in fact, I became adrenaline dependent on you also, the students. Right. So, first 6 months of gestation, which contraceptive is not advisable is a very important question. Question number 96. Yes. So, Monica is proposing B. Vishal Kumar is proposing C. So, combined OCP is doctor, Mitesh, Upen, immediate postpartum period में lactation effect हो जाता, etc. etc. So, combined OCPs is not the preferred option. That is very important. Then, oral contraceptive that provide protection against which malignancy is a very important question. So, question number 97, should your answer, doctor? Against which malignancy? Excellent. Only 2 and 3 things, Ravi Kumar, rocket trader also. Very good. So, only except, please don't forget except, right? Except cervical cancer, endometrial cancer and ovarian cancer, it provides the protection. Now, for the management of menorrhagia, excess amount of bleeding, आपका राय क्या है? What are all the various drugs which are being used in the clinical management of menorrhagia is an important question. Yes. Soumi Mandal thinks, Sudha Shukla thinks A, okay. Then Vishalakshi thinks antifibrinolytic. Rituraj thinks prostaglandins. We don't use prostaglandins. Rituraj, absolutely right. Antifibrinolytic, progesterone agents, NSAIDs are also used. Now, cancer endometrium may worst prognosis, where do you see, is an important question, right? So, if you answer this question wrong, endometrial cancer, cervical cancer, ovarian cancer, fibroma, adenomyosis, hot topics in gynocs, doctor, right? Rituraj proposes clear cell. Kulkarni thinks endometrioid. Anup Chandran, Jindabad. Anup Chandran, you are from which part of the country? From Kerala or Tamil Nadu? So, papillary serous carcinoma, only Anup Chandran, rocket trader and Soumi Mandal answered it correctly. Right. What is the commonest cause? Excellent. Which part of the Kerala, Anup? So, vulvovaginal fistula in developing countries. Should you answer, doctor? In developing countries? What is the commonest cause? So I can see obstructed labor. Vijay Bhaskar, don't break my heart. Right. Very good. Anup is from Trivandrum. And now by joining the YouTube free class every day on Chai Pe Charcha, you have friends across the country. Take a chance to exchange your phone numbers, and now you are a part of a larger medical student community and a good buddy mates during the wonderful days of PG entrance preparation you can remember, right? So 28-year-old woman comes with infertility, husband's semen analysis is normal, endometrium shows secretory changes, and both tubes show tubal blockage. What is your next step in the clinical management? Yes. Very good, Abhishek. Question number 101. I can see Vishalakshi on B. Most of you, for that matter. Excellent, because diagnostic laparoscopy and chromoperturbation is considered to be the management of clinical management of choice. Maternal rubella infection, what is true about it, is an important question. So, starch group of infections always are a very interesting topic. 1 or 2? Yes. They lead to development of microcephaly and CMV retinitis, hematochech appearance, you should not forget. So Srikanth is proposing B, right? Roshan Yadav is proposing D. Yes. So Roshan is absolutely right. It causes blindness with recurrent infection is right. It leads to abortions before 16 weeks of gestation, and there is a 1/4 chance of infection if during the last month of pregnancy if the mother happened to acquire it. For medical abortion, there are certain significant contraindications. Abortion is a common topic in gynops, SPM, and also forensic medicine. So that is the reason, doctor, without a question on abortion, NEET PG nahi hoga. So you should be 100% sure. 1 or 3. Monica thinks A, but Ravi Guna are on C. Monica is absolutely right, along with Srilata and Srikanth. That's right. Uncontrolled seizure, undiagnosed head neck cell mass, hemoglobin less than 8, they're all the important contraindications. So RH isoimmunization के बारे में you should be very sure. Okay, so RH negative mother has delivered RH positive baby. What is your opinion on RH isoimmunization? Question number 104. So everyone is on answer A. That's good. But doctor, we give routine immunoglobulin in all the cases without exception. Is not a true statement. But it is not a routine. Now, is indirect or direct, which is positive? So, if the indirect Coombs test is negative, then that means sensitization has not yet happened. So, prophylactically you can still give. That is a important question. Now, a woman dies from heart disease 6 days after delivery. What do you like to call this? Under which category? Question number 105. Yeah, I think Sumaya Shad also has the right point. Why not routine procedure in all cases? I'll just check that. I'll check this option A. And update you. Yeah. A woman dies from heart disease. What do you like to call this as? We call it as a indirect maternal death, because it's not an obstetric cause leading to the development of the death. Now, in a woman, IUCD is there, but pregnancy happened and that thread is being seen. What is the reason to recommend for the removal of the device? So, to prevent the risk of subsequent septic abortion, preterm labor, that is an indication for the removal is what you need to remember. Tubal recanalization, success kahan hota hai? Question number 107. For the tubal recanalization, yes. 107. Of all the techniques which are available. Excellent. I can see Srikant proposing A and Gulam Bhatt is on B and Abhishek Vyas is yes. I can see A versus B. So, it is a laparoscopic ring application, doctor, where you have a success of tubal recanalization, a greater chance in future if they want once more to become pregnant after sterilization. Now, doctor, एक टेस्ट करके previously unrecognized defects or deficits in the NEET PG preparation को अगर आप screening ऐसे Sunday mock test और daily चाय पे चर्चा करके previously undiscovered areas of poor NEET PG preparation को बाहर निकाले तो उसको क्या कहते हैं? इसको कहते हैं high yield topic discussion. Yield होता है. Excellent. Now, doctor, what is the total osmolarity of nu O or S? If you answer this wrong, no, I will loudly cry. You all have to answer this correct. अगर इसका wrong करे तो I lose my cool. Sudha, I lost my cool. Right? Then, good. So, all of you are ready to take a war knife and slit the throat of the examiner if he happens to ask this question. Excellent. I am so happy. 245, doctor. Standard ORS in 1975 when I was born. Those days में 311 था. बाद में अभी 245. So, this is proposed in 2002. इसमें glucose होता है 75, sodium is 75, potassium 20, chloride 65, citrate 10, total is 245 is what you need to remember. Now. Aedes aegypti's life cycle. अब देखेंगे मच्छर पकड़ने वाले डॉक्टर कितने हैं आप लोगों में? परफेक्ट मच्छर को पकड़े, हाउ डू यू रिकॉग्नाइज? देखो, टुमारो यू वांट टू बिकम DM कार्डियोलॉजी, MS ऑर्थोपेडिक्स. पहला तो मच्छर को रिकॉग्नाइज करने में अगर आप गुड है तो मोनिका थिंग्स Spotted, unspotted wings. Ashwini also throwing the stones on option D. Then Sean Chaco thinks larva has a siphon tube, which is not consistent. Okay. Okay. Then I'm just waiting who will correctly answer. Dasari Sushmita, आप सब लोग wait कर रहे हैं ना? Dasari Sushmita will come and say, hey, my rank in NEET PG is first rank, बोल के बोल देगा कल, right? Hats of you, Sushmita. Proud of you, Sushmita. Very good. See, doctor. Once for all, अंतिम दर्शन. NO plus X कैसे लगता? They are laid singly. They are the ones who are boat shaped, right? They are the ones who are boat shaped. They possess lateral floats. You can see the lateral floats, right? Alapuzza, backwater swimming is NO plus. Aedes, it will be laid singly. It is the Cuban cigar and no lateral floats. Hence, they will sink. Easy to remember. Aedes aegypti, sink. NO plus, floats. Then, Culex क्या होता है? The egg is cigar shaped, but it is laid in a raft, like a raft shaped cluster. And it also has no lateral floats is what you need to remember. Right? So, XR boat shaped is not Aedes. XR boat shaped is NO plus is what you have to remember. Okay, doctor? Sushmita answered B only, no? XR boat shaped is not consistent. Is a correct answer, right? So, not was asked, अरे not को बुलो मत, except को बुलो मत. Correct. Not consistent. XR boat shaped is NO plus. Okay. Now, I'm hearing resound. National Health Policy 2002 में the target that was supposed to be achieved by 2010 क्या था? Elections भी आ रहे हैं, next general elections, you will be the postgraduates while our nation goes into election to vote the Prime Minister. That's good. So, reduce infant mortality to 30 was our slogan long back in 2010, which is not a character of causal association. Question number 117 is the important question. What is your answer, doctor? Causal association, 117. Very good. Abhishek Vyas proposes coherence, but Srikanth is sure on specificity, and Pranahit Reddy is absolutely right. Sensitivity is not a characteristic. Okay. Now, ये फटाफट आंसर करो डॉक्टर. इसका रॉन्ग करे तो I will cry. Discarded tablets are disposed into what color? Once more, next week ऐसा ही रहता है entrance. कुछ भी फर्क नहीं रहता. ऐसे ही मच्छर वाला क्वेश्चन आता, बैग वाला क्वेश्चन आता, सैनिटेशन का क्वेश्चन आएगा. ऋतुराज इश्यूर ऑन येलो. अलेख से क्लीन बोल्ड, रेड नहीं है मेरे भाई. राइट? हाँ, एक्सेलेंट. Krina Shah, proud of you. Yellow is also wrong. अरे black. Discarded tablets. Is it not black? Please recheck. I think so. हाँ? ऐसे कैसे रॉन्ग कर दिया आप सबने? आप सब येलो सोच रहे हैं? 2016 guidelines. Okay. All right, agreed. 50% suffered from cholera, 10% died. What will be the case fatality ratio? Yes, yellow agreed. Yes, yellow is agreed. Now, empty strip is black. Okay. 119. Fatapat bolo. Excellent. 20%. 10 by 50 is 1 by 5 is equal to 20%. Now, which has more than one route of transmission? The last question for the today's evening, doctor. Should your answer? More than one route of transmission. Should your answer? Question number 120. Yes. I can see Monica thinks influenza other than nasal out kuch aata kya? Skin touch kare to aayega kya? Madhu is proposing leprosy. Pankaj Patil also. Sumaya Shad also. Excellent. Excellent, doctor. So it is the leprosy. Give me the board. So those who are courageous are never afraid of battle. Okay? Let me tell you, you're all wonderful students. Every day evening I am seeing you. And since October 15th, almost how many days we had been journeying every day, almost every day. For the last 2 months, we are all working together. You really worked hard. So, first, congratulate yourself that I am the most brilliant guy in this world who is going to make it to NEET PG 2019. Dream for a wonderful branch. Pray God to give you the strength, clarity, confidence, no fizzling, right? And just next 1 week, smoothly sail the ship, and you are waiting for that wonderful gift that you have called the cool mind working in the exam, and you are going to make it happen and win. So good luck to all of you. And Medico app, you have tons and tons of video library. Years together we have been discussing the same topic, high-yield topics. Thousands of MCQs we discussed. Every time you are getting little टेंशन आ गया तो एक छोटा वीडियो देखो, कुछ एमसीक्यू सॉल्व करो, एक क्विज सॉल्व करो, कुछ नोट्स को रिवाइज करो, everything, and then be inspired. That's most important. Thank you very much for a wonderful Sunday. See you all tomorrow.